Today our topic of discussion would be anatomy of nose. Nose is divided into external nose and internal nose. External nose is pyramidal in shape. It is having a root upwards and base downwards. It is osteocartilaginous in framework. By looking at the diagram, we will be able to understand the anatomy. As you can see, that nose is pyramidal in shape, right? It is having a root that is directed upwards and a base that is directed downwards, right? It is osteocartilaginous. It is having bones as well as cartilages. In the bones, it is consisting of two nasal bones, right? And these are the cartilages. This is the upper lateral cartilage. This is the lower lateral cartilage, which is also known as the alar cartilage. And this is the sesamoid cartilage, this small one, which is also known as the lesser alar cartilage, right? And this is the fibrofatty tissue. And if we look on the inferior aspect of the alar cartilage, right, this is the alar cartilage and this is its inferior aspect, you are able to see this is having two cruras. This is the medial crura and this is the lateral crus or the crura, right? So this is important. Moving on to the text, it is written that it is consisting of upper lateral cartilage discussed. The lower part of the upper lateral cartilage is inside, forming the boundary which is known as Lyman vestibule, nasal valve or Lyman nasi. Alar cartilage, it is having two crus, lateral crus, medial crus, and sesamoid cartilage and septal cartilage. Septal cartilage is actually present in between them, right? It is forming the septa, which is dividing the nasal cavity into two nostrils, right? So septal cartilage is quadrangular and it is having four borders. If we talk about the nasal musculature, it is having different muscles. If you remember the anatomy, procerus nasalis, levator levi superioris, aliquot nasi, dilator nares, and the depressor septi. The nasal skin, if you yourself can feel that over the nasal bone, the skin is not that much tight. It is thin and freely mobile, right? If you pinch the skin over your nasal bone, it is thin and freely mobile. But over the cartilages, you cannot pinch it because it is thick and adherent. It is having sebaceous glands. And one important MCQ point is that rhinophyma, which is actually a tumor, which is also known as potato tumor, it is a lobulated tumor of the sebaceous gland and it is occurring due to the hypertrophy of the sebaceous glands, right? Rhinophyma. Moving on to the internal nose. The internal nose is divided into the right and left nasal cavities with the help of nasal septum as discussed earlier. It is having nares, right? The nostrils are also known as the nares, right? And on the posterior aspect, the opening is known as the choana or the posterior nasal aperture, right? Internal nose is having two parts. One is the vestibule and one is the nasal cavity proper. The skin line portion is vestibule and the mucosa line portion is the nasal cavity proper. In the vestibule, as you all know, on the inside of the nose, you are having hairs, right? And those hairs are known as the vibrissae, right? The nasal valve is actually an area which you should be remembering, the nasal valve area, right? If we draw a cross section at the level of the lower border of the upper lateral cartilage, so this is the upper lateral cartilage, right? And its lower border is here. If we draw cross section at here, we will see this is being seen from the inferior aspect, right? So this is the nasal valve area. It is the we would say the narrowest area and it is having an important role in the air humidification as well as the air purification, and it is having an angle of 10 to 15 degree. As you can see in this particular diagram, that this is the nasal valve area, 10 to 15 degree. The cross sectional area at the level of the lower border of the upper lateral cartilage is known as the nasal valve area. Moving on to our next topic or next heading, which is nasal valve area. We have discussed it, and the external nasal valve is the opening of the nasal vestibule, nasal cavity proper. We were talking about the vestibule at this particular moment, right? Now moving on to the nasal cavity proper. It is having a lateral wall as well as a medial wall. You know that the medial wall is formed by the septum. On the lateral wall, there are different structures that you should be remembering. On the lateral wall, there are four turbinates or the concha. Either you say turbinate, either you say concha. Inferior turbinate, middle turbinate, and the superior turbinate. And in some cases, not in every case, but in some cases, the supreme turbinate is also present, right? We will be discussing each turbinate. in the inferior turbinate, the unique thing of inferior turbinate is that it is a separate bone. Otherwise, all other turbinates are the parts of some particular bone. But inferior turbinate is a separate bone. And it is having a depression beneath it, which is known as the inferior meatus, if you remember the anatomy. And this is an important MCQ point, that the nasolacrimal duct is opening in the inferior meatus, right? The middle turbinate is actually, we would say, a projection, and it is large, and it is a part of a ethmoid bone. This was a separate bone, but this is a part of a ethmoid bone, right? And it is attached by the ground or basal lamellae. And its attachment, you should just remember that this is in an S-shaped manner. You should not be remembering the attachment. This would be way more difficult. So one thing about this basal lamellae is that the ostia, some sinuses drain anterior to this basal lamellae. They are known as the anterior group of paranasal sinuses, and those which open posterior to it are known as the posterior group of paranasal sinuses. This is something that you should be remembering in reference to the ground or basal lamellae, right? And this is the source of attachment of middle turbinate, right? Now moving on to the middle meatus. In the middle meatus, there are different structures. As you can see that this is the lateral wall, right? The projection that you see is the inferior turbinate, and the depression that you see is the inferior meatus. The projection that you see is the middle turbinate, and then depression that you see is the middle turbinate. Depression is the middle meatus. This is the superior turbinate. This is the superior meatus, right? So this is the concept. On cut section, when we draw a cut section or when we remove the structure, then we see three different structures in the middle meatus, right? One is the uncinate process. This is actually a hook-like process, and this is the bulla ethmoidalis, in which a lot of sinuses open, right? And in between the uncinate process and the bulla ethmoidalis, there is a semilunar shaped structure which is known as the hiatus semilunaris, and this is actually the gap between the two. This is hiatus semilunaris, right? Moving on to the attachment of uncinate process. Now normally uncinate process, in most cases we would say, it is attached into the lateral part of the nasal cavity. Now you should be understanding this diagram. As you can see that this is actually a we would say a coronal section, right? This is a coronal section, and this is the inferior aspect, inferior turbinate, and this is the uncinate process. This uncinate process is attaching to the lateral wall. This uncinate process is attaching to the base of the skull. This uncinate process is attaching to the medial wall, right? So we would be saying that this attachment of uncinate process is variable. That is why the drainage of frontal sinus is also variable, right? You should be remembering this thing. This is an important in for viva aspect, right? Moving on to the bulla ethmoidalis, that is just a reed, and the atrium of the middle meatus, this is just a depression, and an elevation is agar nasal. These are just a reed. Some important points are here. This one, Haller cells. These are important for MCQ. These are the air cell that are situated in the roof of the maxillary sinus. They're also known as the infraorbital air cell, as I have written it here, that the air cells situated in the roof of maxillary sinus are known as the Haller air cells, and they're also known as the infraorbital ethmoidal air cells. This is important, right? Now there are one more cells which are known as the Onodi cell, right? These Onodi cell are actually posterior ethmoidal cells, right? And they are important surgically because they are having a relation with the optic nerve. So you have to keep in mind that the lateral relation of the Onodi cell is the optic nerve. So you better be careful while performing any endoscopic or surgical invasion, right? And now we will be moving on to the superior turbinate. This is ethmoturbinate. It is also a part of the ethmoid bone, and this is not that much important. This is the supreme turbinate, which is sometimes present, not all the time present, right? Moving on, we will be talking about the medial wall. So these were the four meatuses as well as the four concas of the lateral wall. So the lateral wall of nasal cavity is a little bit complicated, but the medial wall is just constituting of nasal septum, right? Now moving on to the roof of the nasal cavity. Now visualize the anatomy and look at this particular diagram, right? This is the roof, right? You see an anterior slope, you see a posterior slope, and you see a base, right? The anterior slope is formed by the nasal bone, right? And the posterior slope is formed by the body of sphenoid, and the middle horizontal part is formed by the cribriform plate of the ethmoid, right? The floor of the nasal cavity, as you can see here or here, it is formed in the anterior 3/4, right? Anterior 3/4 by the palatine process of the maxilla, and in the posterior 1/4 it is formed by the horizontal part of the palatine bone. Now talking about the lining of the internal nose is important. It is having two parts, we would say, the vestibule and the nasal cavity proper. The vestibule is having hair follicles and the sebaceous gland. There is also an olfactory region, there is a respiratory region, and the nerve supply is important. You should be remembering that this is the olfactory bulb and these are the olfactory nerves. They are passing the cribriform plate, right? But when they enter or pass through the cribriform plate, they also carry along with them the sheets of dura mater, right? So any and arachnoid, we would say the meninges are also coming with these nerves. So any sort of injury to these nerves can lead to CSF rhinorrhea. That is important. Now, the nerves of common sensation are the anterior ethmoidal nerves, sphenopalatine ganglion branches, infraorbital nerve. That is just a read. Autonomic nerve supply is important, that whenever you are relaxed, the parasympathetic system is activated, or we would say that the parasympathetic increases the nasal secretion and the sympathetic decreases the nasal secretion, right? And the Vidian nerve is responsible for the parasympathetic aspect, and the sympathetic is related with the T1 T2 superior cervical ganglion, right? The blood supply is the internal and external carotid system. The lymphatic drainage is the submandibular lymph node, upper jugular nodes. This is whole about the anatomy of the nose. Moving on to the physiology, which is just a little bit. The functions, as you all know, that it is responsible for respiration, air conditioning, protection of the lower airway, air humidification, protection, and the vocal resonance, nasal reflex function like the sneezing, and olfaction, right? So that this is it. And other things that are of prime importance in this particular aspect is that you should be knowing that the axons, whenever, so where is the sense of olfaction recognized, right? Which part? The pre-piriform cortex and the amygdaloid nucleus, where it reaches consciousness. This is important. And the disorders of the smell, you know that anosmia, you are totally having loss of sense of smell. Hypoosmia is the partial loss. Parosmia is the perversion. For example, bad odors are perceived as good and good odors are perceived as bad. That is, we would say, 180-degree deviation of a person, perversion of smell, right? And this is it. So this brings us to the end of anatomy as well as the physiology of nose. Hope you understand.